So good morning, everyone. And my name is Jennifer Blagoji. I'm the External Relations Manager for the UK Ghana Chamber of Commerce. And on behalf of the Executive Director, Addo Chiama, and the entire UKGCC team, we wish to welcome you all to this breast cancer awareness event. By way of introduction, the UK Ghana Chamber of Commerce is a trade association established to promote bilateral trade between the UK and Ghana primarily, and we do this through networking, advocacy, and trade services. We organize monthly networking events and other business promotion events upon request, and we have played a lead role in hosting numerous capacity building webinars, as well as virtual member networking events for our member companies since COVID-19 was declared a global pandemic by the World Health Organization. We invite you all to join the chamber and to follow us on our social media handles, which will be displayed on our screen, to stay up to date with news about us and our member companies as we continue to create networks and connect businesses. Kindly contact us on our info accounts, and to become a member, please contact our membership engagement manager, Margaret Poku, and her number is displayed on the screen as well as her email. So to our main subject for today, breast cancer. So breast cancer is one of the better known and by far the most common cancer amongst women. And it's also a known fact that it also affects men. And it's a lesser known fact that it affects men, and this needs to change. We are doing this in collaboration with Claron Health, and our main objective here is to raise awareness and also to highlight the myths and facts of breast cancer, to promote the need for regular checks and screening, and also to offer expert opinion on breast cancer management, especially during COVID-19 era. We are exceptionally delighted to announce that Claron Health International is offering free screening for all participants. So please make it a point to pass by their offices at the airport residential area for your screening. So to our speaker for today, we have the founder and CEO of Claron Health International, Dr. Dennis Addo, who is a physician, entrepreneur, and an innovator who is passionate about healthcare, especially in Africa. Dennis is currently a global lead for COVID Safe Paths, a project that started from the MIT Media Lab, Cambridge and Massachusetts, USA. He's the founder and CEO of Claron Health International, a managed and digital healthcare company in Africa with global ambitions. Dennis has also been a board member of the National Health Insurance Authority in Ghana since 2017. Dennis co-founded the international award-winning Visa Health application, allowing anyone with a smartphone to interact with medical professionals from the palm of his hand. Dennis is a member of the Ghana College of Physicians and Surgeons and recently graduated with a Master of Public Administration degree from Harvard University, where he was an Edward S. Mason and Adrian Cheng Fellow. As a Cheng Fellow, Dennis is currently piloting Wala Digital Health. At this juncture, I would like to call on our speaker for today. If you have any questions, kindly type out your questions on the Q&A tab on your screen, and we'll do well to answer your questions after this session. We'll also be administering polls during his session, so please do well to also answer these polls to make the session more exciting. We are happy to have you all on, and we hope you all have a fruitful session. Thank you very much. Dr. Dennis, over to you, please.
Thank you so much, Jennifer. Good morning, everyone, and welcome to our section today. We're going to look at breast cancer. Let me start by thanking the leadership and management of the UKGCC for putting together this wonderful seminar. I know we are all still in the COVID-19 pandemic. A lot of people are still talking about COVID-19, but there's still a lot of things outgoing. Breast cancer is one of the big things, and we need to look at it despite the COVID-19 pandemic. The World Health Organization has designated October as the Breast Awareness Month, and typically what we do is to create awareness of breast cancer and get people to know and understand. So today, that is exactly what we are going to do. Just to lamp in, this is our outline for the presentation today. By the time you finish this scope, I hope that you get an in-depth understanding of what a breast cancer is, to know some of the risk factors for breast cancer, and more importantly, to be able to identify the abnormalities in one's breast. That is very critical for us today. That is what will help us to do to a lot of prevention, how to diagnose breast cancer, appropriate management and prevention. So that is what we are going to go through. It's going to be more interactive. I'm going to ask questions and through the polling system in Zoom, and we'll all be able to answer as we go along. We'll share the results, and of course we'll discuss. So even though we are virtual, it's still going to be more interactive. You can be part of the conversation so that we all learn. So I think we'll bring on our first poll question to ask participants to answer if possible. Then we move on to do the presentation. So if you can get a poll going, Margaret. Okay, so this is our first poll. So please answer just the first question. Who typically gets breast cancer? So you can choose one. Who typically gets breast cancer? You can just vote on the first question. Who typically gets breast cancer? Let's just choose one. Okay, I don't know whether participants can see the first question. Who typically gets breast cancer? Some votes are coming in now.
Yes.
Please go through and answer the questions. You can do from number 1 to number 5. First one is who typically gets breast cancer? And then the second question is half of breast cancer deaths are in low and medium resource countries, even though it's more common in white women. Why do you think this is the case? And then the third question is, what age range do women typically get breast cancer? And then the fourth one is, what is the role of breast milk and breastfeeding in breast cancer risk? You can also show your answer to us. And the last question is, do antiperspirants cause breast cancer? Using deodorants and antiperspirants, do they cause breast cancer? So I think participants are still voting. We'll give them 1 more minute to do the voting, then we can continue. Yes. Okay, so I think we can continue now. If everybody has voted, I think everybody has been able to get a chance to vote, so we can continue now. Okay, all right, so I'll share back my screen and we'll continue, yes. Okay, so we'll share the results later as we go along, all right. So I will continue the presentation. Thank you all for participating in our mini poll. All right, so let me start my presentation by telling a story about my patient that I saw that was just about a year ago. So you meet Amma. Amma is a 39-year-old premenopausal woman. She came to the clinic. She didn't have any symptoms. She was just fine. And she wanted to do a routine examination. So we did examination for Amma. She didn't have any mass in her breast, and she was simply fine. And we decided, okay, as part of the protocols for breast examination, why doesn't she get a mammogram? And when we did a mammogram, Amma, who is even 39 years old, was diagnosed with a breast malignancy in her right breast. Remember, she's 39 years old. She did not have any symptoms, and we detected it. So what we did was to take her through a called mastectomy because it has already spread a bit. We had to go and do surgery to take out the cancerous part of it and then continue radiotherapy. She's very fine now and moving on with her life. So what this story illustrates is that those gone were the days when we used to think that breast cancer was limited to a long age range, that is, people who are 60 years and above, 70 years and above. However, studies are beginning to show that even young people from 40 years are getting breast cancer, and we need to be aware. We need to start educating ourselves. We need to start doing self-checks, as we're going to talk about today. Now, let me talk a bit about cancer, stepping back. I'm sure most of you have heard about cancers. Most of you know different types of cancers. There's prostate, there's cervical, there's breast, there's pancreatic, and so many different kinds of cancers. They all share the same common way of doing things. That is, they all start by attacking normal cells. So your cells are the minute, tiny particles in your body that generates life. So everything is about the cells, your brain, your liver, your kidney, all are a collection of cells. Now these cells typically would what? Would multiply, and every single time should be able to produce the function that they are supposed to produce. However, sometimes when they are multiplying, they change in nature or they change in form. So as you can see on the diagram, we talk about first mutation. It means that mutation simply means it has changed to an abnormal form. So the pink one you see is the normal cell, and the first mutation means that something is really not right. You can even see a second mutation. You can see some 2 red dots inside. That means another abnormality is occurring, which again is not really right. Something is meaning something is going wrong. You can also even see a third mutation. That means there's a change. It means that something more abnormal is going on, even a fourth. So as these abnormal changes are going on in the cell, you get to a point where it becomes what we call malignant or cancerous. That means that the cell has started to multiply abnormally beyond what it's supposed to do. And when it happens that we say a cancer cell has developed, that is cancer. That is the basic fundamental of every single cancer that we talk about, whether it's a liver cancer, whether it's a breast cancer, whether it's cervical. It means that the normal cell has started to change abnormality or started to multiply abnormally and growing at a pace that is not proportional to what it's supposed to be. And when it does that, then your body cannot function normally. Your kidney cannot function normally. Your heart, all the organs cannot function normally because the cells have become abnormal. And when it does that, then we say you have cancer. And we have different stages, and breast cancer is basically one of them as well. So this picture shows you a typical cell, and it has become abnormal. I'm sure you can see these dots on top of this particular image here, and that is part of the cancer cells, because typically and normally, maybe it's not like this, is probably a nice rounded shape, but the moment you start seeing these abnormalities coming or not, it means probably it's become cancer. So this is a graphical depiction of what a cancer cell typically looks like, and this is also for the breast as well. Now coming back to some statistics, breast cancer is the most common cancer in women worldwide. It kills women more than any other cancer, and more than 2 million cases plus are diagnosed every single year, leading to about 400,000 deaths. And so think about it, 400,000 productive women who could have added to the workforce, who could have done something productive for our society, all die from diseases like breast cancer, which is truly preventable. And that is the reason why we need to talk about it. Now, we asked you a question about why half of the global death burden is low in low and medium resource countries, even though it's very common in white. Yes, indeed, breast cancer is very common in white women. However, the deaths is typically very high in Africans, Black Americans, and low-income countries. And the question was why. Probably we can share the results of the poll now to see what the answer was. I don't know whether we can share the results of the poll. So share results. Let's see. If you can you all see my screen? So the first question is, who typically gets breast cancer? And most of you were right. It's women who gets breast cancer. Of course, men also get breast cancer, but the percentage is very, very, very minute. Less than 1% or less than 0.5% of men get breast cancer as well. It's typically for men who breast develop. There's something we call in medical terms called gynecomastia. Men sometimes get breasts. I'm sure some men typically are not supposed to get breast. They're supposed to have a bulging chest, but not breast. Or sometimes you see men with breast, and such men have a higher risk of getting breast cancer as well. But it's very, very low, less than 1% of the population. So typically it's women who get the breast cancer. The second question as well, poverty is part of it. However, the biggest cause, most of you got it right, is undiagnosed. In Africa and a lot of countries, we don't diagnose breast cancer early. In Europe, in America, women are screened every single year. It's part of your routine checkups. If you go and see your GP, your physician, those of you who have lived in the UK, if you go and see your GP, one of the first questions they're going to ask you is, have you checked your breast? Have you done a mammogram? If you're a woman who has 40 years and above, this is a typical question your GP will ask you. So most of you are right. The reason why half of the global burden or half of the global deaths is in Africa is because most are undiagnosed. So that is yeah, right, most of you are right about it. So moving right along to in our presentation. One second, let me. Okay, and let's come to Ghana. Breast cancer is the leading cancer in women in Ghana. The second is cervical cancer. I'm sure another time you may do a section where we look at cervical cancer. However, breast cancer is still number one. It accounts for 16% of all cancers in Ghana, and it's typically also rising fast as well. Many women are dying, and more than 3,000 women who can be part of our productive workforce in Ghana die every year from breast cancer. And that's the reason why we need to highlight Pink October to make sure that we create awareness, get more women to check their breasts, to make sure that these 3,000 women, even if we cannot prevent all from dying, at least we can make sure that we can reduce this number of deaths. Even if we can have these deaths, I think we can save a lot of women, and then we can have a very productive society as well. Now, typically in the breast, I'm sure all of you know the function of the breast, so I wouldn't belabor more on it. Of course, it's arguable between the men. I know men typically fight with their children over who has the right to the breast. I'm sure that will be a debate for another day. But there are various questions of the breast. We have what we call the bone part, the muscle. We have what we call the fatty tissues, and then the lobule. This is where the breast milk is produced. And typically, cancers would start at the milk producing glands, which we are calling the lobules or the duct, as you can see from this picture. And that is where the cancers will normally start. We'll come and look at some of the reasons why soon. But this is typically a picture of how a breast tissue looks like. It's the duct and the lobules that give it the soft feeling that, as you can see, or you can when you touch. So what are some of the risk factors for getting breast cancer? Age, indeed, we also asked a question about age. Has age got anything to do? Let's see if most of you got it right as well. So I think if you look at the question, what age range do women typically get breast cancer? Yes, most of you are right. 83% of you said between the ages of 40 and 60. That is indeed the right answer. It used to be that we talk about women who are 50 years above, but no, younger women are increasingly getting breast cancer, and I think it's important that we highlight it as well. So most of you are right. The right answer is 40 to 60 years of age. Good. So yes, so moving right to the presentation. Yes, 1 out of every 8 women have invasive breast cancers at age of less than 45 years. That means that it's common, but if you look at the differences in age, the more you grow, the higher your risk of getting the severe kinds of cancer. So, and 2 out of 3 would get the invasive cancers at ages 55 and above or older. So the more you age, the higher your risk of getting breast cancer. Another factor we talk about is race and ethnicity. Yes, like we mentioned, white women typically get more breast cancer. However, there's a higher death among Black women because of some of the factors we talk about. We don't diagnose it so early. We don't check our breast. By the time it's diagnosed, it's at the higher stage, malignant stage, and little can be done about it. Your genes play a very important factor in breast cancer, as you can see. If your mother was diagnosed with breast cancer, if your sister was diagnosed with breast cancer, what it means is that it doesn't mean automatically you're going to get breast cancer. No, it means that you have a higher chance of getting the breast cancer compared to somebody who doesn't have a family history. So what it means is that you who have a family history, you need to be very aggressive. You need to be checking your breast. You need to be doing more every single year. You can't joke with the examinations as well. So it's very, very important that if you have a family history, typically for the women, you check. There are certain gene mutations which runs in family. You call them the BRCA1, BRCA2. I wouldn't bore you with the medical terms. But what it means is that if you have a family history, if your mother, your sister, your auntie had breast cancer, it means that you need to be checking your breast frequently and even doing more frequent mammograms compared to somebody else. Again, if you're diagnosed with a previous cancer, your chances of getting the cancer again is very high. The other factors, which are minor but also very critical, like early age of period, is believed that women who had their periods very early maybe have a risk. because they've been exposed to hormones for a long time. And women also have late menopause. It's the same concept. If you have late menopause, what it means is that you still be menstruating. And the more you menstruate, the more your body produces the hormones. And the more the hormones are produced, the assumption is that it could also precipitate breast cancer as well. So these are some of the risk factors for getting breast. We don't know the cause of breast cancers. Like a lot of cancers, we don't know the exact cause. We can't pinpoint. The only cancer that we can pinpoint the cause is cervical cancer. We know that it's caused by a virus called human papilloma virus. That's the only cancer that we can put our hand on it and say, indeed, this is the cause of this particular cancer. However, for breast cancer, we don't know. So what we tend to say is that there are risk factors. So when we do a lot of research and we say risk factors, we compare a group of people who have got breast cancer and then we'll follow them back to trace their lifestyle. So if you compare the lifestyle of people who have got breast cancer compared to a healthy group of women who doesn't have breast cancer, then we can get these risk factors. So when we do that comparison in studies, what we find out is that women who have breast cancer tend to have a lot of these factors that is displayed on your screen. And because we tend to get a lot of these factors, then we conclude and say that these are the risk factors for getting breast cancer. But it doesn't mean that these are the causes. The cause is still unknown, and I need to stress that as well. So moving right along, does breastfeeding have any role in breast cancer risk? Let's see what most of you answered in the poll. Does breast cancer, breastfeeding and breast milk have any role in breast cancer? So most of you decrease the risk, increase the risk, not sure. So the correct answer is that breastfeeding indeed decrease the risk. So yes, most of you are right, 33%. It was a little bit close. Oh, sorry, a lot of you were not sure, but the answer is it decreases the risk as well, yes. So those who decrease the risk, you are going to see why. If you are breastfeeding, it's protective. Breastfeeding is protective against breast cancer. We are going to see it shortly. All right. So moving right along. Yes, these are the reasons why breastfeeding can lower your breast cancer. Anytime you are breastfeeding or anytime you are pregnant, what it means is that the hormone that I've talked about already. Remember, I talked about if you have your menses too early, you're exposed to so much hormones, and you have your menopause too late, you're exposed to so much hormone. So the more you are menstruating, the more the hormones, estrogens, progesterones, they are all produced in abundance. And the more they are produced, the more they increase your risk. So the moment you are breastfeeding, it means that all these hormones freeze. There's another hormone that is for breastfeeding to come. It's called prolactin. So that is totally different. And that is actually being proven to be a bit more protective. So once you are breastfeeding, it reduces your risk, making it less for the breast cells to become abnormal or misbehave. So breastfeeding is indeed very protective. And women who breastfeed, or women who have, it's really the women who have so many children rarely get breast cancer. Of course, it doesn't mean that you will not get breast cancer, but definitely the risk is probably a little bit low from studies because maybe they breastfed for children for a longer time. So that is the association between breast milk, breastfeeding, and cancers. Happy to answer more questions if you have as we go along. Now let's look at some signs and symptoms. This is very important. That is the focus of our talk today. October is pink month, and we need to be able to look at the signs and symptoms and protect ourselves. The first is to do self-examination. It's very, very, very important. I can't stress it enough that you need to do, especially for the women. And the men, you can do it for your wives. Don't be shy. You need to do it for your wives. You're going to go through the steps right now of how to do self-examination right after the year. But it's very important that you stand. It's very good to stand in front of the mirror so that you can do self-examination for the woman if you're doing it. Because if you don't stand in front of the mirror, you'll not be able to see there's abnormality. Typically, you would, once you stand in front of the mirror, if there's any abnormalities, imbalances in the breast, you can see it as well. So we'll go through the steps shortly, like I mentioned. You're looking for so many things when you're doing self-examination. The first thing you're looking for when you're doing self-examination is you're looking for lumps. I'm sure most of you know lumps. Lumps feel like a bit rubbery, right? That is something that is not there. It looks like you can move it around the breast when you touch it, and that is why we call it a lump. I'm sure some of you may have seen a lump. other parts of your body, but on the breast, it's not normal, it's abnormal. It doesn't mean it's cancer, but the moment you find a lump, it means that you need to alert your doctor, you need to do further investigations. And so it's very important you look for a lump. It's like a rubbery mass that you can move around in your breast. Also look at your nipple. If your nipple has retracted or is pulled in, it means it's also abnormal. Every nipple typically comes out. It doesn't get pulled in, but even if it's not the way it's supposed to be, typically all of you know, especially the women, how your nipple looks like. If you look at it and it somehow changed abnormally, pulling, then it means it's not normal. There's something called dimpling. Dimpling means that the skin around the nipple are sort of also become a bit rough and retracted. And when you get this dimpling, it means that it's also not normal. Another sign is dripping of breast milk or blood or anything, any discharge. If you are not breastfeeding and you get these abnormalities coming out, typically if you are breastfeeding, it's okay. But if you are not breastfeeding, you haven't given birth, and you start having breast milk coming from your breast, it's not really normal. If you have blood and discharges coming from your breast, it's also not normal. And if also the skin around your breast started to change color, typically it becomes reddened. Sometimes it's hard to see in that skin, but if you change that, the skin around has become abnormal, it becomes a bit large, like the orange, the feel of an orange peel. We call it a peau d'orange. You kind of feel of the orange skin becomes a bit abnormal. Then it means that you also have to alert your doctor because it's not normal. So any skin of these skin changes, you need to alert. So this is what you are typically looking for when you're doing the breast examination yourself as well. That's what we also look for as doctors when you come and you do it for you as well. Typically, you want to do the breast examination at least 2 to 3 days, once a month. It's very important that women examine themselves once a month. You can do it 2 to 3 days after your period. It's very important because before your period, sometimes you may not be able to see, but after your period, because during your period, the breast becomes very dense, it becomes bulging. I'm sure the women can tell that when you're having your period, sometimes your breast becomes big and dense because of the hormones. But after your period, it's normal, it comes back to normal size, and then you can examine normally. So please examine your breast at least once a month, and please see a health professional to examine your breast, if nothing at all, at least once a year. To be good to do twice a year with a professional, and do it yourself once a month, standing in front of the mirror. So when you stand in front of your mirror, the first thing is that you examine the breast and the armpit by raising your arm. You are going to use your finger to do it. You move your finger up and down as is demonstrated here and rub it all over. You go around like in a wedge-like manner. You can see the direction of the arrows are going. That is what we call the wedge-like manner. Then you go around in circles. It's very important. So first you go up and down. After the up and down movement, you do the wedge-like movement, as you can see the direction of the arrows. Then you do a circular movement. It's very important. You divide the breast typically into 4 quadrants. You start from one side, you do the same movement up and down. You go the wedge-like, like you see in the screen, and then you do the circular movement as well. Afterwards, you examine the breast in the mirror for lumps. I'm sure if there's a lump on the skin, you see any changes. You check the nipple, you can squeeze the nipple. If there's any fluid coming out, you're also going to see as well. So this is typically how you would want to examine the breast as well. You start, typically you put your hands on your waist, you stand in front of the mirror, you check the 2 breasts. If there are any abnormalities, straight away you are going to see. Then you can go through the motions as we have described, the palm of your hands as well, moving up and down, wedge-like circles, looking for abnormalities, going back to this slide, looking for all these changes that we talked about, a lump, whether there's a pulling of the nipple, whether there's some dimpling around the skin, there's a dripping of fluid, that's where you squeeze the nipple during the examination, whether the skin around the breast has changed. It's also very important that you look for these changes as well. Now, there's something we call mammogram. I'm sure many of you have heard about it. It's very important. Gone with the days, the recommendation was that women should do mammogram maybe once every 3 years. But as you saw from the story I shared with you about Amma, we did a mammogram for her at 39 years and we detected that she has a breast abnormality. So please, if you are 40 years and above, the new recommendation is that if you can afford do a mammogram yearly. It's a bit, you put your breast under the machine. It doesn't flatten your breast, it's just a temporal thing. And then after the mammogram, your breast will come back to normal. If there's any abnormalities you see, so as you can see, this is a normal mammogram. Of course, you need a doctor or a specialist to be able to interpret for you. But typically, if it's normal, the first picture here is how it's going to look like. If there's a cyst, which is typically not a cancer, it will show like a coin-like structure on the mammogram and we'll be able to interpret it for you. And if there's cancer, it's going to be deep white patches all over the breast, and the radiologist will be able to tell as well. And of course, if there are calcium deposits, the mammogram will be able to tell. So typically, this is what we look for in a mammogram, and it's done for women who are 40 years and above. If you are below 40, you can also do another scan called the ultrasound. The ultrasound is done because women who are below 40 years, their breast is very dense. What it means is that the mammogram cannot detect much because of how dense the breast is. So the ultrasound is using sound waves. So the ultrasound will be able to penetrate these dense tissues of the breast. And then if there are any abnormalities in the tissues, if there are any breast cysts, definitely we can be able to detect it on the ultrasound. So that is the ultrasound for women who are below 40 years. And then of course, mammogram for women who are 40 years. And like I've mentioned, the new recommendation for mammogram is that if you can afford it, try and do it at least once a year. It can be life-saving, very important. But it doesn't substitute for doing your self-examination once a month and a professional doing the self-examination for you once or twice in a year. Then you do your mammogram once a year. And then if you're below 40 years, you can do the ultrasound once a year for your breast. And if there's any abnormalities, you can detect it. So this is how we diagnose breast cancer and breast abnormalities, either by mammogram, either by ultrasound, and even on examination, sometimes you can find a lump, you can find something that we think we can do something about as well, then we'll be able to help. Now, how as breast cancer is typically managed when it's found? So typically, there are about a few options available to doctors if it gets to that stage. We pray that nobody will get to that stage, but the reality is a lot of women are getting breast cancers these days. A lot of women are dying of breast cancer because it's detected very late. So when we find a mass or when we find a cancer, like I mentioned earlier when I talked about AMA, we need to do what we call, if it's a lump, we do what we call lumpectomy. That means you just go and take that particular lump. These are minor or early changes. It means that it's just a small lump, it has not spread. So that means if it's found this early, we are very lucky. The only way it can be found is if you are doing the regular checks and if you are doing the mammograms, you'll be able to find these lumps. If it's spread a bit beyond where the tumor is, then you can do what we call wide excision, means you go and cut a bit bigger. And then if it's further, you do what we call quadrantectomy. And then sometimes the thinner, it means you have to do mastectomy. It means you have to cut a bigger chunk of the breast away. That's what we call the mastectomy. And there's also something we call the total mastectomy. That means you take the whole breast out. I'm sure, I don't know whether some of you heard about Angelina Jolie. She didn't have breast cancer, but because her mom and sisters died of breast cancer, she voluntarily went to take her breast off, and they used artificial breast or implants for her. Of course, you don't need to do that. If you are checking your breast regularly, any abnormality should be detected. So mastectomy is taking part or all of the breast tissue away, and now there are cosmetic surgeries to replace the breast with some prosthetic breast tissue as well. So that is about surgical intervention when we find a problem. Chemotherapy is using chemicals to try and kill the cancer cells. It can be very, very, very difficult to go through chemotherapy. You lose all your hair. So if you see typical cancer patients, they've lost all their hair. These are sometimes the side effects of these chemotherapy. These drugs are very toxic. The problem with chemotherapy is that when we are trying to kill the abnormal cells, sometimes the normal cells are also affected. And then it ends up killing some good normal cells, which we want to preserve. And that is the problem with chemotherapy. But one of the ways of treating. So again, the doctor will decide what kind of combination therapy. You may do surgery and continue with chemotherapy if you have breast cancer. There's also what we call the radiotherapy, where we put you under the machine, and then under the machine we can, that is the radiotherapy machine, and then we'll be able to give you the radiation. The goal of the radiation is to shrink the cancer cells. Again, it can also be very, very bad because once you put you under the cancer cells, once you put you under the radiotherapy machine, it can also affect the normal cells. So that is the challenge with radiotherapy and hormonal therapy as well. Whilst you're trying to kill abnormal cells, some normal cells may be affected as well. So everything is about prevention. If you can prevent, it's very, very, very important. Even though we have mentioned that we don't know the cause of breast cancer, there's been a few associations here and there, and that is why we collated them into what we call the prevention habit. Like I mentioned, we do scientific studies comparing people who have already have breast cancer with people who doesn't have breast cancer. And based on that, we'll be able to get some of the risk factors. What is unique about this group compared to this group? That's the only way we're able to tell from these studies because we really don't know the cause. So some of the things that are being recommended from some of these studies is avoid eating from plastic bags. It's very important. They believe that if you eat from these plastics, sometimes maybe it increases your risk. Avoid overcooked food, especially in the meat as well. I think there's a error in the spelling. And you have to exercise more often. Avoid smoking and drink in moderation is very, very important. You need to do routine self-examination. We've talked about it. Try as much as possible to avoid exposure to chemicals and radiations. Those of you who live close to chemical plants, it's very important. If the levels are above the safe levels recommended by the EPA, you need to be able to relocate. And of course, the annual examinations, we talked about it. So I'll put this picture there to show you that healthy living is very, very critical to breast cancer. It's been shown that people who get breast cancer, I mean, the risk is higher for people who eat a lot of oily, fatty foods and fatty diets. It gives you a predisposition. Maybe it encourages the cancer cells to grow faster. So please substitute your diet. If you know you love any of these junk foods displayed on the screen, I will mention them. I'm sure you know them already. Please reduce them as much as possible and stick to more healthier foods, vegetables, legumes, and grains so that you can live more healthier and prevent yourself from getting breast cancers, apart from, of course, the routine checks up that we talked about. So the last question was, does antiperspirants cause breast cancer? Let's look at what you answered in your polls as well. So many of you said you are not sure that whether antiperspirants, deodorants and stuff causes breast cancers. About 17% said no. They were the bold ones. Yes, that is correct indeed. Deodorants and antiperspirants have got nothing to do with breast cancer. We've done several studies. Series of studies have all gone to show that deodorants, antiperspirants have no link to breast cancer at all. So those of you who choose no, that's the right answer. It doesn't have any correlation with breast cancer at all. So there's no scientific backing to support the claim that using antiperspirant deodorants can cause breast cancer. So this is a myth. Remember the topics about, we're trying to bust out the myth as well. So this is a myth that have been circulating on social media that if you use deodorant, you use certain perfumes, you're going to get breast cancer. There's no single truth to it, so please disregard them. And some people also are wearing a bra to bed can cause breast cancer. There's no truth to that. Wearing bra does not cause breast cancer. And like I already mentioned, I've given some of the risk factors that can lead to breast cancer. But if you're wearing a bra to bed, it's got nothing to, maybe it will make you uncomfortable, but it certainly has no association with breast cancer. And then the wire bras have not been implicated in breast cancer as well. So like Jennifer mentioned earlier, we are doing free breast screening at Claron Medical Center, Airport Residential Area. We would love to have you around. I'll share the links for you to book for the free breast screening whilst we are doing the Q&A. Please come around. You can book an appointment. If you want the team to do some breast stuff for your company as well, I'm sure we can arrange for that as well. But you're doing the free breast screening. Just fill the form, fill the Google form, fill the Calendly link, and then come and then let's do it for you. Like I mentioned, you need to see a health professional at least once a year, if you can twice a year, to examine for you. And then you yourself, you do it every single month. It's very important. And then the health professional will do it for you. The health professional is very important because they have been trained professionally to detect certain abnormalities which you may not be able to find during your own self-examination. And because you're doing self-examination, you may miss one or two things, but a health professional will be able to definitely detect one or two abnormalities which you may not find. So please book a link. I'll share in the chat room. You can book to come as well. So the message today is that if you didn't learn anything at all, the message that we are trying to show, the summary of the talk is that October is breast cancer month. So we want you to think pink. Think pink because women are still dying of breast cancer. Yes, there's COVID, but so many 400,000 women are dying every year of breast cancer, which is even higher. So please think pink. And then also leave green. It's very important that you leave green. So that's the message for today. Think pink and leave green. So if you see any women around, and the message and the slogan should be think pink, leave green. Leave green means live healthy, avoid the junks because they may give you a higher risk of breast abnormalities. So I want to thank you so much, and then I'll leave it back to Jennifer, and then we can start the Q&A. Thank you so much.
Thank you so much, Dr. Addo. I must say I was glued to my screen the whole time, just looking at your presentation. And we thank you for the important message here. Think pink and live green. That's a message for all of us. And thank you so much for this insightful presentation. I'm happy to announce we are streaming live on Facebook. So some of our participants have joined on there. We'll be happy if you also have people who want to join and can later listen to it. We'll be broadcasting this on all our social media platforms after this webinar. So we'll move to the Q&A at this juncture. Dr. Addo has just put his link there for those of you who want to go for this free screening, which ends in 2 days. Kindly click on the link and book a slot for that. Okay, I guess I'll just start with my question whilst we wait for the other questions to come in. I just wanted to know, so does fasting, like intermittent fasting, lower the risk of breast cancer in women? Do you know does that have any correlation with breast cancer?
Thank you, Jennifer. As far as I know, fasting has really no correlation with breast cancer. In fact, fasting is good for you. I mean, it's not only spiritually, but also medically. You're supposed to fast once in a while. I mean, you need to give the body time to adjust, and then also adjust from all the plenty food that we subject the body to. So once in a while, if you can do fasting, maybe once a month, is very good.
So I'm talking about some people like me who fast like every day.
Okay.
For medical reasons.
Okay.
Does that like help you? Like you fast for maybe 18 to 20 hours a day? Would you have a lower risk factor? That's what I want to know.
Not at all. There's no correlation between the two. Remember, the fasting has got to do with your stomach and abnormal digestive system. Right. And then the breast is also a whole different system altogether. So the two are really not related. If anything at all, it may even be protective for you because you're not exposing yourself to so much food and so much chemicals. So why not? Fasting is always good. Of course, not too much, but at least once in a while is good, yes.
Okay, thank you. So kindly do well to put your questions in the tab provided. Ruby says she can't see the link. Okay, doctor has sent the link again, so you can please go there and book your session with them. Do we have some questions from there? I mean, the presentation had everything. I had 3 questions and all those questions were answered except the fasting questions. So, yes.
I think Margaret has raised her hand, right?
Please, Margaret. Please go ahead, Margaret, please.
Okay, so Dr. Addo, I have a question for you. So if you have been diagnosed with breast cancer, is it a doctor that is going to advise which way to go, whether chemotherapy, radiotherapy, or a mastectomy? Is it a doctor's advice or the person's advice?
Yes, so typically when you are diagnosed, there is a decision between you, the patient, and your doctor. and it's between the two of you because breast cancer treatment is very expensive. We are so fortunate that now the government of Ghana is paying for breast treatment through the National Health Insurance. They are paying for some of the treatment. However, it's still very expensive, and because of that, you need to plan it between the patient and the doctor. So the doctor, depending on the stage, typically we stage it from stage 1 to stage 5. Stage 5 means that it's so advanced that there's little we can do. However, the lower the stage means that we can do something about it. So depending on the stage, your doctor will sit down with you and then you plan. Maybe we need to take off your breast. Are you willing for us to take off your 2 breasts? It's a decision. Of course, you cannot do anything without your consent. So we need to discuss with you that, are you happy for us to take if taking your 2 breasts will save your life, why not? But again, the doctor cannot force that decision on you that you need to take your breast off. It means you have to have that interaction with you that, okay, Margaret, this is a situation. Is this something that you agree with? And then you can take it from there. So it's a plan and a joint decision between the doctor and then the patient. Yes, sure.
Okay.
So I take it every stage of the cancer will have a better advice. So if you're in stage 4, they will advise maybe chemo or radiotherapy rather than taking the lump out alone.
Exactly. So typically, if it's early stages, we prefer surgery where we go and take the lump off that area. But if it has spread, if it's stage 2, stage 3, where it has spread beyond the cells, then it means that after we do the surgery, that's number 1.
Okay. Okay. So we have some questions in. The first question is, what is the current statistics of women with breast cancer from last year till now? Is there are there any statistics in Ghana, I assume?
Yes. So I think in Ghana, the challenge in Ghana is that we really don't have the full statistics. I mean, they're still collating. But what we know is that from the studies that have been done, we know that more than 3,000 women died last year from breast cancer alone. So it's something that is rising, and I think more probably, if we get the statistics right, maybe be more, because sometimes we don't. Typical sometimes in Ghana, when you go to hospital, we start treating you for so many things before we get to the actual cause. So I believe the statistics may be higher, but hopefully as the data gets very accurate, we will be able to get accurate statistics for you. Yes.
Okay. So our next question, does being naturally busty predispose you to breast cancer?
That's a great question. Being busty is not necessarily related to breast cancer. Please don't get that wrong. The only problem with people who are busty is that they have back pains, isn't it? Sometimes the muscles, the breast is pulling them, and sometimes they complain of back pains and chest pains and all that. But it's got nothing to do with breast cancer. Again, being busty too, the only thing is that maybe when you're doing the examination yourself, you may find it difficult to examine your breast alone. That is why you need a professional to help you, because maybe you find it difficult to do it. Or maybe you can get your husband to help you to do the examination, and then you can do the mammogram also. But being busty has got nothing to do with breast, because the only thing is that sometimes it causes a lot of back pain and other things. But apart from that, there's nothing wrong with it. Yes.
Okay. And then what may be the cause of pains in the breast, even though breast examination by medical officials do not reveal any lump or problem with the breast?
Yes, so there are so many other problems with the breast apart from cancers. There's something we call the mastitis, that is inflammation of the breast. When you have an inflammation of your breast, it can be very, very, very painful. Sometimes even if you touch the breast, you have pain. Sometimes the breast is very hardened as well. So if you have infection of the breast, it's not only breast cancer that affect the breast. There are different conditions. Mastitis is the common one. Sometimes there can also be trauma to the breast. Maybe you accidentally hit your breast, can also cause severe pains as well. So these are the 2 other things as well that typically cause. Apart from that, like I said, if some people sometimes also have a bigger breast, sometimes because the bigger breast sucks on the muscle and the tissue, it causes them to have pain, which they attribute to their breast. But maybe because of the pain that the breast is sagging on them, then they have these challenges. So these are some of the things that cause pain of the breast, yes. Of course, cancer also causes pain, but it's not as common as these conditions, yes.
Right, right. And we have another question. Also, being sexually active, does being sexually active help reduce your risk?
All right. So, as a general statement,
Smiling.
that's a good question. So, generally speaking, all research shows that more sex you have, the more healthier you live. You understand? It's a general rule. I mean, even for the men, I mean, who are predisposed to prostate cancer, they say men who have more sex has lesser risk for prostate cancer and all that. However, there's no correlation between having more sex and breast cancer. There's no direct link between it. But it's a general rule that sex generally, people who have more are more healthier, they are more happier, they are less stressed. So that's a general rule, but there's no direct link between breast cancer and having more sex, yes.
But I mean, it's a medical it's kind of a medical advice you can give to people that they should try to have more sex in their lives, just to.
I know it's very, very important. They've done a lot of studies. I mean, even for college students, and then they compare those who have more sex, and then they realize that who have more sex, they get less sick. They tend to come to the hospital less. Yeah, they are less stressed, and then they are more happy. So, I mean, medically it's good, but there's no direct protective benefit for breast cancer. Definitely not.
And it's not scientifically proven, right?
Which one?
Having more sex and living longer.
No, it's a lot of research have shown that it's more beneficial for your health. So definitely it may have a correlation to that one. Yes, absolutely, sure. What are the stages of cancer? Okay, I think we've explained. I think we explained it here about stage 1 to 5, and typically the first stage means that it's just a small lump or a small tissue where the tumor is. Stage 2 means that it's spread, but it's not gone a bit far. It's just around the breast area. Stage 3 is that started to spread beyond the breast. It's going into your blood vessels. Stage 4 means it has spread beyond to other organs. And stage 5 is like it's almost all over your body, and there's little we can do about it as well. So stage 1, we can do something about it quickly if it doesn't spread. Stage 1, stage 2, if we detect it at the best stages to catch the breast cancer, the moment you start going to stage 3, stage 4, they become very difficult. You need to take off your whole breast, even in stage 4, and still give you a lot of radiotherapy and chemotherapy and all the complications that are associated. So the earlier, the better for us, yes. Mm-hmm.
The earlier, the better for us. So early detection is key here.
There's another question, right?
So I understand cancer is genetic. How true is that, and can it skip generations?
Yes, so cancer is when we say it's genetic, what it means is that, like, especially for breast cancer, I mentioned there's a specific gene called BRCA1 and BRCA2. It runs in families. What it means is that if your mom had a breast cancer, there's a higher chance that you may get some. That doesn't mean that you are going to get some. It's not automatic. What it means that you have to live more healthier. So indeed, you can skip generations. However, if you compare you to somebody who doesn't have these particular genes, it means that you who have these genes or you who have this family history, your risk is higher compared to somebody who's not. So you, that person, must do a lot of mammograms, a lot of breast exams. Some people have talked about Angelina Jolie, the movie star. Her mom and sisters were diagnosed with breast cancer. And she didn't have breast cancer, but she went to take off her breast as a preventive measure and use prosthesis. I don't think you need to be that radical, and you just have to be doing the checks and all that. So yes, you can skip generations as long as you are living healthy, you are doing the regular checks and all that, you'll be perfectly fine. But if you're not checking, then that's where the problems come in. Yes.
So again, a follow-up question: can cancer go away naturally, or they all have to be treated?
Cancers doesn't go away naturally. They can take years. It's like a silent killer, right? Some cancer can start very small, and then for 5 years, it may not even grow. But give it another 5 years, something small may trigger it, and it may start growing very fast. So cancers are very notorious. They are very difficult. Something small, and 5 or 6 years down the line can start growing faster. So they don't go away naturally. But the earlier it's detected, you need to shrink it and it doesn't spread. So once the cell becomes cancerous, the most important and critical option is to take it away or shrink it. If you don't, and you leave it there, it can take 10 years, it can take 20 years, but definitely one day it will start spreading fast and it may lead to death and all that. So it's very, very important that as soon as the cancer is detected, we do something about it. Yes.
Okay. Okay. So yes. So if okay, so I think that's it for now. We'll be happy to share. If there are any other questions, please share with us on our Facebook platforms or any other platforms, and we'll be happy to send it over to Dr. Dennis for answers. Once again, special thanks to the team from Claron Health International. They've been very supportive, and thank you for collaborating with us to host this webinar. We'll be doing other sessions like this in the coming year, so we hope you all join us. And please visit their facility at the airport residential area. And don't forget to also go for your free screening as well. Please follow UKGCC on our social media platforms I mentioned earlier on YouTube, Facebook, Twitter, and Instagram. And do well to also participate in all our programs. We organize capacity building webinars as well as virtual networking events. And we have a few webinars lined up for the rest of the year before next year. To join as a member company, please contact us on info@ukgcc.com.gh. Our membership engagement manager will be happy to take you through the process to join. So the slogan or the message, the big takeaway for today is we should think pink and live green. So thank you all very much, and a very good bye to you. Dr. Addo, is there something you want to say to close?
No, I think you've said everything, and you really concluded, think pink, live green. That's the message. Every day, with your fellow ladies, just tell them, think pink and live green. Thank you.
Yes. Okay. Thank you very much, and bye-bye.